Hello and welcome to ALH 4, Chapter 13 lecture, Assisting in Ophthalmology and Otolaryngology. Our learning objectives for this lesson are defining and spelling and being able to pronounce the terms listed in the vocabulary, being able to explain the differences among an ophthalmologist, an optometrist, and an optician, identifying the anatomic structures of the eye, being able to describe the process of vision, being able to differentiate among the major types of refractive errors, summarizing typical disorders of the eye and eyeball other than refractive errors, being able to do the following related to diagnostic procedures for the eye: define the various diagnostic procedures for the eye, perform a visual acuity test using the Snellen chart, and access color acuity using the Ishihara test. Explain the purpose of and the proper procedure for eye irrigation and the installation of eye medication. Identify the structures and explain the functions of the external ear, middle ear, and inner ear. Describe the conditions that can lead to hearing loss, including conductive and sensorineural impairments. Define other major disorders of the ear, including otitis, impacted cerumen, and Meniere's disease. Do the following related to diagnostic procedures for the ear. Explain diagnostic procedures for the ear. Use an audiometer to measure a patient's hearing acuity accurately. Identify the purpose of ear irrigations and installations of ear medication. Demonstrate the procedure for performing ear irrigations and accurately instill medication ear drops, as well as summarize the nose and throat examination. And you will be doing the actual throat cultures with Hannah next semester in your lab class. Describe the effort of sensory loss on patient education. Discuss legal and ethical issues that might arise when caring for a patient with a vision or hearing deficit, in addition to requirements established by HIPAA and the Americans with Disability Act amendments. That's a lot that we have to accomplish this week. So let's look at the examination of the eye. What is ophthalmology? Ophthalmology is the science of the eye and its disorders and diseases. An ophthalmologist is the physician who specializes in the diagnosis and treatment of disorders and diseases of the eye. And it's important to note that an optometrist is not a medical doctor, but can perform eye examinations, diagnose vision problems and eye diseases, and treat visual defects through corrective lenses and eye exercises. Then we have an optician. An optician is trained to fill prescriptions written by the ophthalmologist and optometrist for corrective lenses by grinding the lenses and dispensing eyewear. The medical assistant must be familiar with the normal anatomy and physiology of the eyes, ears, nose, and throat. Here, you can find this in your book on figure 13.1, and this shows the anatomy of the eye. And the eyeball consists of 3 layers. Please take a look at this more closely in your book. You can see here the functions of the major parts of the eye. This is table 13.1, and I want you to take a look at this as well in your book. What are the 3 layers of the eye? So the outermost layer is made up of the white sclera. It protects the eyeball and the cornea, which allows light to enter the eye. The choroid is the posterior portion of the middle layer of the eye, and it contains many blood vessels that supply nutrients to the outer layers of the retina. The inner layer of the eye includes the retina in the posterior portion and the lens in the anterior portion. Let's look at the process of vision. What occurs in the brain when an electrical impulse is received? Let's talk about that first. So the impulse is received in the visual cortex of the occipital lobe of the brain and is interpreted, and a picture is created. So in the process of vision, a visual impulse begins with light passing through the cornea. The cornea refracts the lights and passes it through the aqueous humor and pupil into the lens, and then the ciliary muscle adjusts the curvature of the lens to again refract light rays. Then these rays pass into the retina, and it triggers a photoreceptor or photoreceptor cells of rods and cones. Then the light energy converts into an electrical impulse and is sent through the optic nerve to the brain. This is a demonstration. You can find this in your book of in figure 13.2, and these are refractive errors, so it shows the myopia, and that's here in A, and the hyperopia here in B, along with how they are corrected. So here's the correction process, and here's the correction process. Please take a look at this in your book. So let's look at some other refractive errors. Presbyopia. The changing point of focus from distance to near becomes difficult due to age. I actually have this right now. And there is a difficulty seeing at a reading level. I also have an astigmatism, and this occurs when light rays entering the eyes are focused irregularly. It occurs because the cornea of the lens is not a smooth sphere, but has an irregular shape. This is corrected with glasses, contacts, or sometimes surgery. How is presbyopia treated? It's treated with a combination corrective lens known as a bifocal lens or a progressive lens correction. And these are used to focus both distal and proximal objects directly on the retina. How do you think an astigmatism affects vision? It's like attempting to focus on objects seen through a wavy piece of window glass. So can you imagine that? And that therefore you can tell that you are unable to see things correctly, and that's where you get the lens is not smooth sphere, but there's irregular shapes. Surgical correction of astigmatism attempts to reshape the cornea into a more spherical or uniformly curved surface. Let's look now at strabismus and nystagmus. Strabismus is when the eyes do not track together and they do not look in the same direction. In children, it's caused by weakness of the eye muscles. Nystagmus is constant involuntary movement of one or both eyes. It's accompanied by blurred vision, and it's caused by an abnormal function in part of the brain that controls eye movement. Adults can develop strabismus because of a condition or disease elsewhere in the body, such as diabetes mellitus, muscular dystrophy, or hypertension, or as the result of a head injury. It's caused by muscle weakness in children, like we stated before. A patient with signs and symptoms of nystagmus first should undergo neurologic evaluation to determine the cause of the disorder with treatment based on those findings. Now we're going to look at infections of the eye. Hordeolum, also known as a stye, is a localized purulent infection of sebaceous glands of the eyelid. Chalazion is a small cyst from blockage of the meibomian gland. Keratitis is an inflammation of the cornea, and it results in superficial ulcerations. Conjunctivitis, also known as pink eye, is an inflammation of the conjunctiva caused by irritation, allergy, or bacterial infection. Blepharitis is inflammation of glands and lash follicles along the eyelids. It's important to note that bacterial infections are treated with antibiotic ophthalmic preparations. Disorders of the eyeball. Corneal abrasions. Corneal abrasions are caused by foreign body or direct trauma. The diagnosis is confirmed by the fluorescein stain highlighted by cobalt blue. Foreign bodies are removed first, then treated with antibiotic ointment and nonsteroidal anti-inflammatory ophthalmic ointments. Cataract. A cataract is a cloudy area and it blocks the passage of light into the retina. Conditions may result from eye injury, exposure to extreme heat or radiation, or inherited factors, but is usually due to aging. With cataract, we see blurred and diminished vision, and an effective treatment is surgical removal of the lens. Some symptoms of corneal abrasions include pain, inflammation, tearing, and photophobia. And most cataracts develop slowly and progressively as a result of the natural aging deterioration of the lens of the eye and typically occur after age 60. You can find this in your book as figure 13.3, and at the top here, this shows the corneal abrasion and it's stained with the fluorescein. In 13-4 here on the bottom, it shows the corneal abrasion stained with fluorescein and highlighted by the cobalt blue light. So you can see the difference there. We're going to continue with disorders of the eyeball. So let's talk about glaucoma. Glaucoma is common and serious, and it's increased interocular pressure, IOP. Glaucoma damages the optic nerve and causes blindness if untreated. The tonometer and the gonioscopy used to diagnose glaucoma. The treatment is miotic and beta blocker eye drops or surgery. Macular degeneration. Macular degeneration is progressive deterioration of the macular lutea, and it causes severe vision loss and blindness. There is currently no clue, but they've found that antioxidants may prevent or slow the progression. There are two forms, dry, and dry is 90% of the cases, and wet. So the two types are chronic open-angle glaucoma and acute closed-angled glaucoma. Chronic can be experienced for a long time without noticing symptoms, whereas acute has more obvious symptoms such as severe pain, headache, and inflammation. How do physicians screen for glaucoma? So the ophthalmologist first uses a tonometer with a slit lamp to measure increased intraocular pressure. And then the gonioscopy also can be used to examine the aqueous fluid drainage system and to determine whether the glaucoma is open or close-angled. This is figure 13.5 in your book, so please take a look at that. A shows the open-angle glaucoma, so you can see here. And B shows the closed angle glaucoma, and that is here. There are diagnostic procedures for